Hello, my name is Zachary. I'm a physician assistant at Fairbanks Urology, and with me is Chad, and we are going to talk about vasectomies. And Chad has some questions that are commonly asked by my patients about vasectomies. So here we go.
Yeah, hello. What is a vasectomy exactly?
I'm so glad you asked. Vasectomy is a form of permanent birth control for men. It is permanent. We can edit that out.
Is it permanent?
It's permanent in 1,999 cases. Because you have a 1 in 2,000 chance that your vasectomy could reverse itself magically because you're part Wolverine. I don't know.
What about percentage of effectability? Like how effective is it? Um,
So
I
the
mean,
first
is it
times,
100% birth control? I mean, or is there a little percentage that something can actually get through?
so it depends on what you're talking about. So the success rate of the procedure is over 99% successful first time. So important fact, you have to confirm that's successful before you go out and practice, sex without birth control. So we'll do a semen analysis about 2 to 3 months after the vasectomy to confirm that you no longer have sperm in your ejaculate. And if that is the case, then it is almost 100% effective. There's a 1 in 2,000 chance that later on, years down the road, that you could somehow manage to self-reverse your vasectomy, but the odds of that are pretty darn low. Good question.
Okay. Yeah, I've heard of women when they got their tubes tied that somebody has gotten pregnant afterwards
Mm-hmm.
before years down
Yep.
the road.
Yep. It's
Yeah.
a low chance, but it is possible.
Okay.
But the odds are pretty good that
So
it won't.
yeah, good. So what can a man expect then when they get a vasectomy?
I'd like to promise the most pleasant experience of your life, but it's probably not. It's probably like the third most pleasant. So vasectomies are done in the office nowadays. It's a straightforward procedure. We use local medication to make sure that there's little to no pain. And then it takes about 15, 20 minutes, and then you're off the table, you're out and about. There's no wait time for you to get up and continue living.
Wow. So you said little to no pain, but do some people actually? I mean, is there some pain to involved?
So it's a little uncomfortable at the start because we have to numb the area of interest. And so the numbing medication can cause a slight discomfort when it's going in and working. But after that, you shouldn't feel any pain. But I can't promise no pain because we either use a needle or what's called a Manajet, which inserts a spray of the medication. So you're gonna feel that. There's no, unfortunately, way we can get around that, unless you sign up for either nitrous oxide or IV sedation, which we offer if you are nervous about procedures in the office.
Yeah, because I think that might be one thing that I might be afraid of is actually going in and getting a needle, put in my private area like that.
Yeah, surprisingly, I haven't found too many men who are really looking forward to a needle in their scrotum. I don't know why,
Right.
but it seems to be a pretty rare attitude to take. So we do offer a needleless technique. So like I said, we can just use a device that just sprays the medication into the scrotum without any needles involved, because that is a concern. So it's called a needleless technique. So we've already solved that problem with technology.
Cool.
Yeah.
So about how long does it take to recover after you get a vasectomy?
It's a great question. So individual results may vary, but in general, about a week. So you'll have the most kind of discomfort and kind of swelling and kind of want to protect the area the most after the first 2 or 3 days after vasectomy. But after that, all that should get better progressively day by day. And by 1 week, most people are out doing everything they were doing before. You might still have a little bit of soreness here and there in your activities, but that'll go away over the following week.
All right. Well, one of the questions that I've always kind of wondered too is, will you still ejaculate after having a vasectomy?
Yeah, very common question. You still do have ejaculate after a vasectomy. The only difference is that ejaculate will no longer contain sperm, but you will have the full force and stream of you that you did before. We'll edit that part out.
Okay. It's not going to be cut down by any percentage or anything like that then.
It's extremely marginal unless you have put it in a measuring teaspoon. You're not going to notice the difference.
Okay.
Yeah.
And if, we decide to want to have children again or anything like that, is the vasectomy reversible?
It is reversible, but going into your vasectomy, you should go into it never wanting children again. So it's considered permanent sterilization. Permanent sterilization. So you should use it for long-term, forever birth control. Now, that being said, it is reversible. It's a actual surgery, so you'd have to go under general anesthesia to get it reversed. And the longer you've had your vasectomy, the less likely it is to work. So it's not 100% that we can reverse your vasectomy. It's also not something that insurance companies want to pay for. And so you will have to probably pay for that out of pocket. So I tell people going into a vasectomy that should be used for permanent sterilization. It can be reversed, but it's going to be expensive and it doesn't always work. So you should be really careful when considering your options for permanent sterilization.
Okay. Well, thank you. That's all the questions I have.
Perfect. Thank you. Have a great day.